The dark truth about nursing homes. 6 hidden dangers. Every family should know. Welcome to our video on the dark truth about nursing homes. 6 hidden dangers every family should know. If you or your loved ones are considering a nursing home, it's crucial to be aware of the potential risks that aren't always visible on the surface. In this video, we'll uncover 6 hidden dangers that every family should be aware of before making such an important decision. We believe this information is incredibly valuable, so please leave a like, comment, and don't forget to subscribe to our channel for more content like this. Also, share this video on your social media to help others. Number 1. Lack of proper care in nursing homes, a growing concern. One of the most alarming hidden dangers in nursing homes is the lack of proper care due to staff shortages. Many facilities, particularly those that are understaffed, struggle to provide the level of attention and medical care that residents need. This is a widespread issue across nursing homes, and it can lead to serious health complications for vulnerable individuals. When there aren't enough caregivers to go around, it becomes difficult for staff to meet the needs of each resident in a timely and thorough manner. Routine tasks, such as assisting with mobility, feeding, administering medication, and monitoring vital signs, may be delayed or missed entirely. As a result, residents can experience neglect, which may lead to pressure sores, malnutrition, dehydration, and even falls or other preventable accidents. Additionally, the lack of staff can cause emotional distress for residents who may feel ignored, isolated, or abandoned. This can result in mental health issues, such as depression or anxiety, which further impact a person's overall well-being. The shortage of skilled healthcare professionals in nursing homes also means that those who are employed often work under stressful conditions, which can lead to burnout, decreased morale, and ultimately more mistakes or neglect. In the worst-case scenarios, these factors can lead to preventable medical emergencies or long-term decline in a resident's health. Families need to be proactive in researching the staffing levels of nursing homes, ensuring that their loved ones receive the proper care they deserve. Number 2. Abuse and neglect in nursing homes, a hidden danger. Abuse and neglect in nursing homes are among the most disturbing and hidden dangers families need to be aware of. Unfortunately, physical, emotional, and even financial abuse can occur behind closed doors, often without detection. Vulnerable residents are at a higher risk due to their reliance on staff for daily care, making them easy targets for mistreatment. Physical abuse. This can involve intentional harm such as hitting, slapping, or restraining residents inappropriately. In some cases, residents may also suffer from neglect, where essential needs such as hygiene, medication, or mobility assistance are ignored, leading to health complications. Physical abuse is often difficult to detect because the signs can be misinterpreted as natural signs of aging or illness. Emotional abuse. Emotional or psychological abuse can be even more insidious, as it may not leave physical marks. It can involve verbal harassment, humiliation, threats, or deliberate isolation from others. This can have long-lasting effects on the mental well-being of residents, leading to depression, anxiety, or diminished quality of life. Financial abuse. Financial exploitation is another form of abuse that's unfortunately common in nursing homes. This may involve staff or even family members taking advantage of residents' vulnerability to steal money or assets. In some cases, residents may be coerced into signing over their savings or making questionable financial decisions. It's crucial for families to stay vigilant by frequently visiting their loved ones, regularly checking for signs of abuse, and maintaining open communication with both the resident and the staff. Ensuring respect and dignity in care is essential to protecting the rights and well-being of elderly individuals. Number 3. Poor hygiene and sanitation in nursing homes, a critical concern. One of the most significant hidden dangers in nursing homes is poor hygiene and sanitation, which can have serious health implications for elderly residents. Unclean facilities create an environment that fosters the spread of infections, illnesses, and diseases, putting vulnerable individuals at risk of severe health complications. Nursing home residents, often with weakened immune systems or underlying health conditions, are particularly susceptible to infections like urinary tract infections, UTIs, respiratory infections, or gastrointestinal illnesses. Inadequate cleaning practices, such as dirty bed linens, unwashed surfaces, or improperly sanitized medical equipment, can harbor bacteria and viruses that spread quickly in a communal living environment. This can lead to outbreaks of infections that might otherwise be prevented with proper hygiene protocols. Additionally, poor sanitation can also lead to the development of pressure ulcers or bed sores, which are a result of prolonged immobility and insufficient attention to skincare. If not properly cleaned and treated, these sores can become infected and lead to more severe health problems. Furthermore, an unsanitary environment can cause emotional distress for residents. Living in a dirty, poorly maintained facility can exacerbate feelings of neglect, isolation, or depression. It's crucial for families to regularly inspect the cleanliness of the facility, especially in common areas, restrooms, and the residents' personal spaces. Regular monitoring, asking the right questions, and ensuring that staff follow appropriate cleaning protocols are essential steps to ensure a safe and healthy living environment for loved ones. Number 4, overmedication in nursing homes. A dangerous practice, overmedication, is a growing concern in many nursing homes, where the use of excessive medications can have serious and harmful consequences for residents. In some cases, nursing homes may overprescribe drugs, especially sedatives, antipsychotics, or mood stabilizers, to control behavior or manage residents with complex health needs. This practice is often a response to staffing shortages or high patient numbers, where it may seem easier to medicate a resident rather than invest time in proper care and attention. While medications are an essential part of treatment, they must be prescribed carefully, with attention to potential side effects and the individual needs of each resident. Overmedication can lead to dangerous health complications, such as increased confusion, sedation, dizziness, and an overall decline in physical and mental well-being. In some cases, the side effects of these medications may be mistaken for the natural effects of aging, leading to misdiagnosis or improper treatment. Additionally, medications like antipsychotics can increase the risk of falls, fractures, and even death in elderly patients, particularly when used for non-approved purposes, such as to calm restless behavior. Overmedication can also result in a diminished quality of life for residents, as they may become lethargic, disengaged, or unable to participate in activities due to the sedative effects of certain drugs. To avoid the risks of overmedication, it's vital for families to closely monitor the medications prescribed to their loved ones, ask for regular medication reviews, and advocate for non-pharmaceutical interventions whenever possible. Regular communication with healthcare providers can ensure that medications are used appropriately, safely, and only when necessary. Number 5, financial exploitation in nursing homes. Protecting your loved ones. Financial exploitation is a serious and often overlooked danger in nursing homes. In some cases, families may be unaware of hidden fees or the mismanagement of their loved ones' finances, leaving them vulnerable to exploitation. This can occur in various ways, from excessive charges for basic services to outright theft of personal assets. Nursing homes may charge fees for additional services or amenities that were not clearly disclosed up front, and families might unknowingly agree to these charges without fully understanding the costs. In some cases, fees for basic care can escalate rapidly, causing financial strain on families who are already managing significant expenses for their loved ones' care. It's essential to review all contracts thoroughly and ask for detailed explanations of any charges that seem unclear or excessive. Beyond hidden fees, Financial exploitation can also involve staff members or even family members taking advantage of a resident's cognitive decline or dependence on others. This can include stealing money, forging signatures, or pressuring residents to make financial decisions that benefit the perpetrator. Nursing homes are obligated to safeguard residents' finances, but this doesn't always happen. Families need to stay proactive by regularly reviewing financial transactions, including bank statements and credit card bills. They should also ask for detailed invoices and receipts for any services or purchases made by the nursing home. Transparency is key. Ensuring that there are no hidden costs or mismanagement of funds can prevent financial exploitation and protect both the resident and their family from potential harm. Conclusion. In conclusion, while nursing homes are meant to provide care and support for our elderly loved ones, there are hidden dangers that families must be aware of. Issues like lack of proper care, abuse and neglect, poor hygiene, overmedication, and financial exploitation can severely impact the well-being of residents. Staying vigilant, regularly visiting, asking the right questions, and reviewing contracts and financial transactions can help prevent these dangers. By taking a proactive approach, families can ensure that their loved ones receive the respectful, safe, and quality care they deserve in a nursing home environment. You said,